Today, I want to talk about the female reproductive system, both in anatomy and histology. Here you can see the parasagittal section of the female pelvis. In this section, you can see some internal and some external part of the female reproductive system. I start with the external part. In the external part, you can see the mons pubis. This is located just anterior to the pubic symphysis. This is the adipose tissue, which is covered by the skin and thick hair. You can see the labia majora and labia minora here, and number 4 represent the clitoris. The clitoris, labia minora, labia majora, all together are called vulva or pudendum in the female. In this picture, you can see number 5. Number 5 is called vestibular gland. The vestibular gland can make mucus, which can help lubrication of the vagina and the external genitalia. When you look at this picture, you can see number 6 and 7. Actually, this is the wall of the body, the anterior part of this wall, which is associated with the urinary system and genital system, is called urogenital diaphragm, and the other part, which is located posterior, is called this region. It's called pelvic diaphragm. Here you can see the urinary bladder, and number 9 represent the ureter. You see that the ureter come to the bladder in the posterior wall. This region is the genital region. You can see number 12 as the ovary. Number 13 is the fimbria of the infundibulum. And number 14 is the infundibulum, the first part of the oviduct or fallopian tube. These fimbria start to beat at the time of ovulation, and they can catch the secondary oocyte, which is come from the ovary at the time of ovulation. And then you can see number 15 here, which is the ampulla. You know that the ampulla is the longest part of the fallopian tube, and this region is the best region for the fertilization. And number 11 is the broad ligament. This broad ligament is the ligament which can attach the ovary oviduct and the uterus to the wall of the pelvis. This picture is the mid-sagittal section of the female reproductive system. In this mid-sagittal section, again, you can see the clitoris. The clitoris is the homologous of penis in the male. It's full of erectile tissue, and it becomes erected at the time of sexual stimulation. This part is the urinary system. You can see the bladder. This region is the bladder. This is the cavity of the bladder with many rugae. And the muscle in the wall of bladder is called detrosor muscle. After that, you can see number 17, which is the urethra. The urethra has 2 openings. One opening is called internal urethral opening, which is here. And the other opening is called external urethral opening. The internal urethral opening is protected by internal urethral sphincter, which is the smooth muscle. And the location of the external urethral sphincter is the part where the urethra wants to pass the urogenital diaphragm. So if you check this picture, you see that the location of internal urethral orifice and internal urethral sphincter are in the same level, while the external urethral sphincter and the external urethral orifice are not near each other. The next part is the female part, the female genital system. Here you can see the ovary. The ovary has fundus, it has body region, and then we can see the cervix. And here is the lumen of the uterus. The wall of the uterus has 3 layers. The first layer, which is number 12, is endometrium. Then number 13 is the myometrium, the muscles, and the last layer is called perimetrium. And the end of the uterus is called cervix. Here you can see the cervix or cervical canal. The cervix has 2 openings. One opening is here. It's open to the uterus. We call it internal os. One opening opens the cervix to the vagina, and we call it external os. And the cervix can make a mucus which can help capacitation of the sperm, nourish the sperm, and at the time of pregnancy, it can make thick mucus which we call it cervical seed. As you see in this picture, we have projection of cervix in the vagina, and this projection is this region. It makes 2 small pouches. One of them is here and the other is here. These small pouches are called fornix. One of them is located anterior. We call it anterior fornix. One of them is located posterior, and we call it posterior fornix. After that, you can see the vagina. This is the vagina or vaginal canal, and at the end of vagina, you can see external vaginal orifice. Pay attention, the vagina is the fibromuscular tube, and this tube has many rugae inside, which can help expansion of the vagina at the time of intercourse and labor. This is the other model which we had in the lab. This frontal section of the female reproductive system. Number 1 is the ovary. Number 2 is the ovarian ligament, which can help attachment of ovary to the body of the uterus. And after that, this complete region is called oviduct. The first part of oviduct is number 5. This is infundibulum. And number 4 are the fimbria in the beginning of infundibulum. After that, you have number 6, which is the ampulla, the longest part of the oviduct. And number 7 is called isthmus. The isthmus is thin and short, and it can help attachment of the oviduct to the body of the uterus. Here you can see the uterus. Number 8 is the fundus. Number 9 is the body of the uterus. And then you can see the cervix. In the wall of the uterus, we have endometrium, myometrium, and the last layer is called perimetrium. The cervical canal has 1 internal os and 1 external os. And because we have 1 protrusion here, you can see 2 pouches. These pouches are called fornix. And number 14 is the vagina with many rugae, which you can see here. And you have number 3 here. This is a vast broad ligament, which can help attachment of ovary, oviduct, and uterus to the wall of the pelvis and together. Here is the structure of the ovary. Before I talk on this ovary, I want to show you one picture here. In this slide, you can see the female reproductive system. You can see the ovary, you have the oviduct or fallopian tube, you can see the infundibulum and fimbria. This region is called ampulla, and the last part is the isthmus. You can see the uterus with its fundus, body part, and cervix. The wall of the uterus has endometrium, myometrium, and perimetrium. The ovarian ligament can attach ovary to the uterus, and the broad ligament can attach ovary, oviduct, and uterus together and to the wall of the pelvis. Now, I want to talk specifically about the ovary. In this picture, you can see the ovary. The ovary has two important regions. One region is located outside, we call it cortex, and one region is located inside, and we call it medulla. In the cortex, we have ovarian follicle in different stages of development. And in medulla, we have connective tissue and blood vessels. Around the ovary, we have a connective tissue which works as the capsule of ovary, and we call it tunica albuginea. On the surface of tunica albuginea, you can see simple cuboidal to low columnar epithelium, which is called germinal epithelium. The germinal epithelium, the name is germinal, but actually it can't do any germination, and it's only the epithelium which is located outside. Then you can see the different follicles here. You know that the follicle is the oocyte and the granulosa cells or follicular cells around. In the cortex, beneath the capsule, we have many primordial follicles. In the primordial follicles, we have oocyte and simple squamous granulosa cells. Then these primordial follicles, a group of them, start to grow at the beginning of menstrual cycle, and you can see the primary follicles. These three are primary follicles. First, we have one layer of granulosa cells. We call them early primary follicle or unilaminar primary follicle. Then the number of layers increase, and we call them multilaminar primary follicle or late primary follicle. In the late primary follicles, we have secretion of a glycoprotein from the granulosa cells and the oocyte. And this glycoprotein can make whitish color here. It's not white, but in this picture it's white, and we call it zona pellucida. This zona pellucida can help making a wall around the oocyte when the head of the first sperm comes inside. So just one sperm can come to the oocyte. And after that, this zona pellucida becomes thick and it's impermeable to the other sperms. So we don't have a condition which we call it polyspermy. The zona pellucida is a glycoprotein which is secreted from oocyte and granulosa cells, both of them. After the primary follicle, we have secondary. The granulosa cells start to make a secretion, a fluid, which we call it follicular fluid, and it's located in the cavity, which we call it antrum. When you see the antrum, your follicle is secondary. The antrum becomes bigger and bigger, and you can see the mature follicle. This fluid make pressure on the oocyte and push the oocyte in one side of the follicle. So the oocyte is not in the center anymore. A group of granulosa cells which are around the oocyte are called corona radiata, and the other granulosa cells are located around the follicle. The connective tissue which we have around the follicle from the primary to secondary and Graphene become more organized, and we call them theca layer. First, we have theca folliculi. Then these theca layers are arranged in two layers. inner and outer or internal and external. The theca folliculi is important for ovulation. Here you see that the Graphene follicle is beneath the capsule and it's like a pimple which come up from the surface of the ovary. The pressure of the antrum and the squeezing of the theca cells can help ovulation. The ovulation takes place as you see here. The oocyte with corona radiata as the supporting cells are released and the granulosa cells and theca cells remain in the ovary. They change to a body which we call it corpus luteum, and the corpus luteum is responsible for making progesterone. This corpus luteum makes progesterone for 15 days. If pregnancy happens, it makes progesterone for 3 months. If we don't have pregnancy, after 15 days, it's changed to corpus albicans. And corpus albicans is the white body in the ovary, and it takes about 3 to 4 months to completely regress. So this is the summary of the ovary. This is the real picture. In this picture, you can see the cortex and the medulla. In the cortex, we have follicles. In the medulla, we have blood vessels and connective tissue. You can see some types of follicle here. Some of the follicles, like these follicles, are primary, and all of them has more than one layer of granulosa cells, so they are multilaminar primary follicle. Here you can see the germinal epithelium on the surface of the ovary, and beneath it, this region is called tunica albuginea. Here you can see one secondary follicle. This is the oocyte. You can see the corona radiata and the granulosa cells around, and this is the antrum. And around the follicle, you can see the connective tissue, which make a circle, and we call it theca folliculi. This is the mature follicle or Graphene follicle. You can see the oocyte, the granulosa cells, and the antrum. And the theca layers are located around the follicle. This is mature, and the mature follicle, as I told you, are like a blister, a pimple on the surface of the ovary. When ovulation takes place, you can see the corpus luteum. For 8 hours, the corpus luteum is called corpus hemorrhagicum because we have a rupturing of the blood vessels and a small amount of blood inside. But after 8 hours, this blood is reabsorbed and we can see actual corpus luteum. The corpus luteum regress if we don't have pregnancy and change to corpus albicans. In this picture, again, you can see the cortex of the ovary. In the cortex of the ovary, you have the tunica albuginea, the capsule. On the surface of tunica albuginea, you have germinal epithelium. Then you can see these follicles. All of them are called primordial follicles. The primordial follicles are the follicles which contain the flat granulosa cells around themselves. The next follicle is called the unilaminar primary follicle. It has oocyte and one layer of granulosa cells around. And the last one is called multilaminar primary follicle. You can see the oocyte and more than one layer of granulosa cells around. So this is the multilaminar primary follicle. This one is the unilaminar primary follicle. And here you can see the structure of the corpus luteum immediately after its formation, which I told you we call it corpus hemorrhagicum because it contains blood clot inside. And you can see a shrinkage structure here. Okay, I go back to this picture. This is the model of the ovary. In this model, you can see some structures. First, you have the ovarian ligament, which can attach the ovary to the uterus. You can see broad ligament here. The ovarian artery and the ovarian vein are located here. You can see the tunica albuginea, and on the surface of tunica albuginea, you have the germinal epithelium. And this is the internal part of the ovary. In this internal part, you have the cortex around and the medulla in the center. And in the cortex, you have the different phases of follicular development. The small follicles beneath the capsule are called primordial follicle. The primordial follicle starts to grow and make unilaminar primary and then multilaminar primary follicle. Number 10 is the follicle which is regressed. And we don't have secondary in this picture. And number 11 here is called the Graphene follicle. This is the Graphene follicle. You can see the oocyte, which is ready to become ovulated, and this is the antrum, which you can see here. In this picture, you can see the corpus hemorrhagicum bleeding inside the antrum immediately after the ovulation, and then the corpus hemorrhagicum changed to corpus luteum, which is responsible to keep pregnancy for the first 3 months by secretion of progesterone. And if we don't have pregnancy, it changed to number 14, which are the corpus albicans. This is the next model which we have in the lab. In this model, again, you can see the oviduct. This part is infundibulum and the fimbria, and this part is called ampulla. And number 4 is the broad ligament here. Number 5 in this region is the ovarian ligament, and number 13 is the suspensory ligament of the ovary. Here you can see the cortex of the ovary and the medulla. We can't see inside the follicles, just we can see the surface of the follicles. Number 6 are the smallest, they are primordial. Number 7 become larger, which is primary. Then you can see the secondary follicle, and number 9 is the Graphene. The Graphene is ready to do ovulation, and after that we have corpus luteum, and then we have corpus albicans. Between corpus luteum and corpus albicans, you can see the regress or degenerating corpus luteum. This is the mid-sagittal section of the pelvis in female. You can see the ovary, then we have the oviduct. Number 2 is the oviduct or fallopian tube. This part is called uterus. You can see the fundus, the body of the uterus and the lumen of the uterus, and after that we have cervix. Number 6 is internal, and number 9 is the external os of the cervix. And number 10 and 11 are fornix. One of them is located anterior, we call it anterior fornix. One of them is located posterior, we call it posterior fornix. And after that you have vagina. Number 13 is the external vaginal orifice. Number 14 is labia minora, and 15 is labia majora, and number 16 is the clitoris. And number 17 here shows you the mons pubis. And this picture shows you the female reproductive system from top. You can see the ovary, you have the oviduct, and this is the uterus. And here is the urinary bladder. The oviduct has different parts. Here are the fimbria, infundibulum. After that, you have ampulla, and the last part is called isthmus. Number 6 is the broad ligament. And now you can see the histology of the ovary. You have the tunica albuginea, the capsule, and the germinal epithelium on its surface. This region is the cortex, and after that you have medulla. In the cortex, the majority of our follicle in this picture are primordial follicles. These are primordial follicles, the oocyte with the flat granulosa cells around. When the follicle grows, it can make primary follicle. This primary follicle has more than one layer, so we call it multilaminar primary follicle. Here is the oocyte, and these are the granulosa cells. All of these pictures, these follicles are primordial follicles. They are small, they have oocyte and the flat granulosa cells around them. Here you can see the primordial follicle. After that you have unilaminar primary follicle. They grow and make multilaminar primary follicle. All of them are primordial follicle. They contain oocyte in the center and flat granulosa cells around. This one is the primary follicle, which is unilaminar. You can see the oocyte and the cuboidal granulosa cells. Unilaminar or early primary follicle. Here we have multilaminar primary follicle. You can see the oocyte and the layers of granulosa cells. And this thick pink layer here is zona pellucida, the glycoprotein which is secreted by granulosa cells and oocyte. Again, multilaminar primary follicle. This is the oocyte. This is the zona pellucida, and these are the granulosa cells. This is the secondary follicle because we can see the antrum. The antrum is created here. Secondary follicle or antral follicle. You have the oocyte. This is the zona pellucida, and all of the cells are granulosa cells. Again, secondary follicle, you have the oocyte, zona pellucida. This is the antrum, and the cells are granulosa cells. And here you can see the Graphene or mature follicle. This is the oocyte. These cells around the oocyte are corona radiata. This large cavity is antrum, and all of these cells are granulosa cells. This is the Graphene follicle, which is ready to do ovulation. And after ovulation, you can see corpus luteum. The corpus luteum is the aggregation of granulosa cells and theca cells. And this is the other corpus luteum immediately after its creation. You see that it appears like a shrinkage particle. So this is about the female reproductive system.